Dr. Jaffe, if someone shows up reactive to gliadin, but not to gluten, what does that tell you?
Boy, isn't that a good question? What if they react to gliadin, but not to gluten, and I presume not to wheat? So if we had only tested them for wheat, or only tested for wheat and gluten, we would have missed the fact that they have a reaction to gliadin. And what does that say? It says that maldigestion exists. It says that they will have other foods or chemicals to which they react. That's why it's important to be comprehensive in these cases. I would do the professional comprehensive plus profile whenever possible for the LRA Vitalysac test. And what it says is that the digestive problem is not primarily in the stomach. In fact, food is getting broken down in the stomach by stomach acid and pepsin. That's a good thing, at least to some extent. The food is starting to get digested. And the antigen, the wheat gluten gliadin, is not so much affecting the duodenum as it is other parts of the small intestine. And so many people who have gliadin only will have a ileocecal valve problem. They will tend to have immobility or hypermobility of their L5-S1 joint. They tend to have certain kinds of back pain more often than not. And the gliadin, because it is released from the wheat and gluten later on in digestion, affects further down in the intestinal tract, often leading to a whole host of indirect symptoms that lead to a whole host of specialists who don't take a whole look at the person and miss the fact that this is really an immunologic problem, an immune hypersensitivity, a delayed allergy problem, more than anything else. And so gliadin is important to test for separate from gluten and wheat because it hides inside the gluten, and when it gets released lower in the small intestine, it can cause mischief.